Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Viper. Viper is hematotoxic, hemotoxic, and hemolysis. And Viper causes intravascular hemolysis with depression of coagulation, increased eonism with intense local reaction seen at the site of bite in viper. Local reaction. There is pain, oozing of blood, swelling, blisters. All these extend to the entire limb and then to the trunk. The patient has delayed death with necrosis of skin, muscle at the bitten area. Systemic reaction shows hemorrhage in every part from above downwards. Intracranially, there is conjunctival. First, there is intracranial hemorrhage, followed by conjunctival and scleral hemorrhage, then bleeding from the ear, followed by epistaxis, which is bleeding from the nose, hemoptysis, that is bloody vomiting, then bleeding in the viscera. There is GIT and GUT, gastrointestinal and genitourinary bleeding, and finally there is hematuria. Cause of death is shock and hemorrhage. Viper.
thank you and thank you for watching.